reach out and use the dietitians like they should. My experience has never been that a dietitian has tried to tell me what to eat, what not to eat, but suggested this would be better for you, and why don't you give it a try? When Rose was diagnosed with Parkinson's, and I think a lot of people don't realize because of the movement disorder and the tremors with Parkinson's, they burn up calories constantly. And Rose was losing a lot of weight. And I had a number of conversations to help me decide how to supplement her diet to keep weight on her. For Rose and I, the nutrition program at the VA and the home-based care team has been wonderful. It's kept us on our feet and upright, and their sole interest is to keep us healthy enough to stay in our own home for many, many months now that we've been with them, and it's not a thing I regret about it.